Another piece of primary care model, right, is that, again, when you think about when you establish a primary care physician, this is somebody that's like your go-to expert, right? It's not like you go see them one time, you get discharged, and you don't go back and see them, right? Like that's like your person. And so in establishing your primary care physical therapist, we should be your person for, again, musculoskeletal, not only pain and injury, but prevention and optimization.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Welcome back to the Undercurrent podcast. And today we have on for the second time, Angie McGilvrey, the co-founder and co-owner, along with her husband, Joe, of Apex Physical Therapy in Southwest Florida. They have two locations in Fort Myers and Cape Coral, Florida. And she, you may remember her actually from our earlier episodes or seeing her on our social media, because she has already been on episode 9 of the podcast. And in that episode, we talked a lot about their pain to performance model. We talked about how they have built their business around this target avatar of the CrossFit or obstacle course race, Spartan race type of athlete, how they're able to help them get out of pain, recover faster from injuries, and then continue to train them and help them with optimal performance, with recovery, with maintenance, performance enhancement, all these other things. And talked about, of course, about how they're using the newbie all throughout that entire continuum of care. So if you haven't heard that yet, we encourage you to go back and listen to episode 9 to get a sense of what Angie's up to. And we'll start today with just a little quick overview of her practice and give you a sense of what's going on so you have the context. And then we're going to talk about some more elements of what they're doing, because I really see, getting to interact with clinicians and practice owners all around the country. I see Apex as really the apex, no pun intended, of what is possible for a physical therapy clinic. And I hope this inspires you listening to give you some ideas of, what private practice outpatient physical therapy can possibly be, because they're doing some really exciting stuff at Apex. So now, finally, Angie, welcome.
Yeah, thank you so much. It's so exciting to be back on again. Thank you for the opportunity.
Yes, wonderful to have you here. Of course, we just got to connect again recently. You and Joe and a few, Leo and Ben from your team, a couple of your staff clinicians were here in Austin for our Center of Excellence training. So we're very excited. I mentioned how I think Apex can be an example, an inspiring example for people to see what's possible. And we see that at NeuFit too, which is why we are proud to have Apex as one of our first regional centers of excellence. And it's a place where, for people listening, it's a new program for us that Angie actually has provided a lot of input and helped us create. But these are facilities that are doing excellent work with the newbie, where people can go to observe and get training, in different regions of the country, making it easier than necessarily having to travel to Austin. So we're very proud, Angie. Thank you for your input on that program, and very proud to be working with you on that and have you be a part of it.
Oh my goodness, our pleasure, and super excited to have anybody come and share in a day at Apex, and just anything that we can pour into them. In our experience, since 2018, we've been utilizing the NeuFit in our practice, and so we would just love to be able to share those experiences and the wins and some of the obstacles that we've already been through, and just, really set other practitioners up for success.
Awesome. I really appreciate that. You are a go-giver, you and Joe and your team. You instilled that culture in your team too. So it's great. And in terms of, I'm excited to touch on all these different elements. And I think that unifying theme is going to be this inspiring example of what is possible for outpatient private practice physical therapy. I want to talk about your, how you're marketing locally, stuff you're doing on social media. But before we get into that general concept, I want to ask you about one specific thing that has been on your social media, where you did some posts where you were actually signing termination letters with third-party insurance payers, and
Yes.
it was exciting. It was a little bit controversial, but can you talk to us about what you did, and even more importantly, why you did it?
So, Garrett, you had said what is possible, right, in the world of physical therapy. And right now there's a lot of attention on some of the negative. We hear about declining reimbursements. We hear about the shortage of physical therapists across the country. We hear about the raising salaries that are becoming just disproportionate, again, to what insurance companies are valuing physical therapist care at. But on the other side of the coin, I believe that there's so much opportunity out there in the world of physical therapy. I also believe that our profession is key in being the primary care provider for neuromusculoskeletal pain, injury, and prevention. And so that is my overarching purpose, is to establish Apex as that practice model. That requires autonomy, is a huge ingredient there. So with that being said, what was one of the most restrictive things in our pursuit of autonomy, and that was third-party payers. Most significantly, we fired United Healthcare, we fired Cigna, and we fired Humana. Those three gave us the most burden for our patients with regards to access of care. I think that was one of the primary things. When I go back to listening to my patients, right? What do my patients value? What is it that my community wants? The number one overarching theme that came up was access or availability. When they have an ache, a pain, something doesn't feel right, I'm concerned, I don't know if I should compete tomorrow, everything from I just rolled my ankle to I don't know if I should, do this high-level competition tomorrow. They want an answer, and they want us to be available and accessible to them. And that's the value that they see us providing. If I have to wait 72 hours, 2 weeks sometimes for an authorization in order to provide the patient that value, I'm failing that patient. I'm failing my community. So that was really one of the biggest drivers. There's several burdens that we could talk about that these carriers put on us that we weren't allowed to meet the expectation and the value that our patients were looking for. So yeah, we've moved on and are continuing in the pursuit of autonomy.
I love how you frame that up. I also love, that's a great soundbite, saying how you fired UHC, fired Humana. That's awesome. And you also said something in there that I want to pull out and discuss a little further. You mentioned, PT as a primary care profession for any musculoskeletal injuries, issues, et cetera. So part of that, of course, you just touched on is access, right? You think about who your primary care physician would be. Could be the sort of the first line of defense that you would go to, and they would tell you to see a specialist or do this or do that, in a traditional, medical system model. So can you tell us more about what you mean by that? Obviously, access is part of it. What does that whole picture look like? What does it look like for PT to be a primary care profession?
Yes, so access is definitely a piece of it. The other side is excellence or expertise in our profession, right? So we have to also be able to quickly and accurately and safely triage and diagnose what's happening with our patients. They're coming to us as their primary care. So ankle sprain, right? It's very interesting because, just as a side note, my colleague Danica and I were just looking at an article that was surveyed over 800,000 lateral ankle sprains, and only 6.8% of that population saw a PT within 30 days of their care.
Wow, that's
like, if that doesn't drive us to be better, like, holy cow, it's crazy. But yeah, anyways, it's expertise. So one of the other pieces that we've brought into our practice that really helps guide that expertise is diagnostics. And we utilize diagnostics in a couple of different ways. We utilize musculoskeletal ultrasound, where we're actually able to take a look inside and see all of the, soft tissues, look at things dynamically, while they're moving. How does that ankle move? Even do some stress testing, some ligamentous testing, and watch what's happening. We also do EMG nerve conduction studies, looking at the actual nerve tissue, right? And the degree of damage, the amplitude versus, or the axon versus the myelin, and all of that dysfunction, which I'm super excited to later have Joe talk to you about on a subsequent episode. So stay tuned. That's super exciting. And then newbie. What's that?
Look, foreshadowing there. It's
yeah. And the newbie device, newbie has a fantastic diagnostic capability to it as well, in determining what's happening, in our neurological system. So by incorporating, all three of those technologies, we really feel that that's helped us make sure that we are providing the most, safe, accurate, the fastest value for our patient. And after that access, they really want to know what's wrong. How do we fix it? Right? And so once they get to us, like, tell me what's wrong, tell me you can fix it. And now they have hope. I can't tell you how many times that I've had the privilege of hearing a patient tell me after they've come in day one, we take them through an ultrasound. We tell them what's going on with their ankle. We take them through NeuFit in their rehab that day one, and they walk out, 80% better than when they walked in, and they tell me, you gave me hope. Like that value, like that's what they want. They wanted the plan. They wanted to know that they can get better, and that hope. So to me, 80% better day one versus never seeing them for 30 days. That's the mission that we're trying to, that we're trying to push across the country, and hopefully motivate and inspire others to take on this model.
I love that. I feel inspired, and imagine everyone else listening to this will as well. In terms of, I love that access, excellence, diagnostic capabilities, and treatment capabilities. So you're handling, the breadth of anything non-surgical that people have in the musculoskeletal realm. And then also to give people just, a sense of the breadth of what you're offering. You also, right next door to Apex, have your adjacent sister business that is also providing other types of services for ongoing health optimization. And can you talk a little bit about Live Resilient?
Yes, thank you. Another piece of primary care model, right, is that, again, when you think about when you establish a primary care physician, this is somebody that's like your go-to expert, right? It's not like you go see them one time, you get discharged, and you don't go back and see them, right? Like that's like your person. And so in establishing your primary care physical therapist, we should be your person for, again, musculoskeletal, not only pain and injury, but prevention and optimization. And that's the other side of our scope of practice that not only has NeuFit allowed us to step into through strengthening, conditioning, athletic performance, but also the other side where we look at optimization. And through Live Resilient, we do some pretty cool modalities like infrared sauna, cold plunge, a sensory deprivation salt tank, some nutritional counseling that's stacked on with some DNA testing. So trying to look at that holistic, view of our patient, again, as a primary care provider, and yet still what remains under our scope of practice as physical therapists.
That's awesome. And that's a new development in the time since we recorded episode 9, a few years ago. And what was the story behind that? Was it the suite next door to your existing Apex office came available, and what was the backstory?
Yeah, that's pretty cool, because in episode 9, it was myself and Jason Wins. He is my certified strength and conditioning specialist who when we began this transition into the whole performance side, like, he was my guy, he's my right hand, and he's also, I have to, will always hold a special place in Apex's heart, because he was the one who one day, him and I were wrapping up after taking care of some patients and clients, and he looked at me and he just said, "Changing lives." And I was like, that's it. That's our purpose. That's our why. Right there. That's it. And so that was probably 2018, 2019. And literally, as you said, Garrett, in 2021, 2022, the space next door became available. And me and Jason, again, just happened to be talking, and he looks at me and he's like, "Maybe I should rent the space next door." "What are you going to do there?" "I don't know. Let's treat holistically. Let's do all the other things. We're really good at getting people to move better. Now let's get them to live better. Let's do the other things." And so we really honed in on the live better piece of move better, feel better, live better. And we said, okay, let's stack on live better. Let's really expand this whole kind of prevention optimization side of the practice.
Awesome. I love it. And you touched on there that sense of purpose, changing lives, having that why. I think that's very important. And I love how you have infused that into your culture. I mean, your people, I talk to people on your team, and they will say that we're here to change lives. We're here to disrupt the status quo. We're here, they're saying these things. So just another good example to call out for everyone listening here is having these simple phrases like Angie does and repeating them often so they really sink in. That it's not, having a good purpose or mission statement isn't in complexity. It's actually in simplicity, because it has to be able to land with everybody, be meaningful, be inspiring, have an emotional effect. So I love what you've done there, and you're truly leading by example. And we've gotten a sense of the practice now and how you're leading by example there. Let's shift to a slightly different aspect in terms of how you are marketing that practice now, because I know you're doing some unique things on social media, digitally and in person in the community. And can you tell us a little bit about your marketing strategy and marketing efforts? You start wherever you like, whether you start in person, start with social media, whatever, wherever you'd like to go, you may go.
Permission granted. Okay. Well, I think, Garrett, you beautifully segued into that, because the marketing platform has to start with your why, right? And so I encourage, other owners or other practices, other providers listening, knowing that why and being able to very clearly articulate that is the foundation for where your marketing strategy begins. And also looking at, I think it's important for us to understand, because I didn't get any of this in PT school, right? I didn't learn how to market or how to run a business. This has been through, the 20-something years that I've been trying to navigate this course. And the thing that I've learned and taken away is the difference between marketing and sales. And that is a foundational piece when we start to look at how do you market your practice? How do you market? Marketing is all of the wonderful things that you get to do that leads to a sale, right? That leads to that transaction. And in my world, a sale is a life changed, right? So what are all of the things that I'm going to do from a marketing perspective that are going to allow me to change a life? And so we can start diving into social media, because I think that that's probably the place that a lot of other, I know, PT practices struggle is social media, because you hear every other comment or whatever it is, and it's like, how to get more new patients, social media marketing. And if you hear that, like, how to get more new patients is selling, right? Like new patient selling. Social media marketing, no. Marketing is social media is building your brand. It's telling your story. It's allowing people into your world of what's happening, in your practice, in your community. What do you stand for? What's your purpose? And so that's where I challenge, and I know a lot of people are like, I just don't know what to do. I don't know where to start. You're already doing it. I promise you're already doing it. You do it every single day in the four walls of your practice. You just now have to start telling the world about it. And so some of the small little finite strategies that we use, I have two amazing people on my team that one of their roles is to go through the clinic and video on their phones. It's nothing fancy, nothing that costs a ton of money. And they video what's happening, and a lot of it is, again, you going back to changing lives, right? Look at patients whose lives were changed today. Just capture that, right? Build the brand.
Let me interrupt you for 1 second. I think that's, excellent, brilliant, highly recommended. Some people might be listening to that and thinking, well, what about HIPAA? And what about, do I have permission from people? Can I just go around? So just in case that's jumping out, yeah. Well, and they might have trouble, registering that if that's on their minds. How do you address that?
Yes. So when we first started doing that, we have a waiver that they sign. And so when we first started doing that waiver was something that, like, for every new patient that would come into the practice, like, we would actually physically sit there with them and, have them sign it. Now it's just part of our intake paperwork. Like, it's so natural. It's also a very natural thing because people many times are coming to me because they've seen us on social media so many times. So now the expectation is kind of there. But in the beginning, especially, I would recommend you just have that conversation. Like, oh, by the way, Meg is going to record your story today. Is that okay with you? And even though they may have signed the thing, I'll typically say that to them first too, or have my providers even just like say that to make them comfortable. And then on the way out, they'll have you sign the form. So that's kind of how it started. And now it's just turned into kind of a natural vibe.
Awesome. I know you had a good system. And that's essentially the same thing we do at our clinic in Austin as well. We have it in our intake paperwork, and they'll just sort of verbally confirm with people before something happens. Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Newbie can impact your life, please visit our website at www.new.fit. That's NEU.FIT. So you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there. So yeah, I love those social media posts. And I talk to people around the country in different practices, some in corporate practices, some in private practices like yours, and they'll say, oh, I saw Apex. I always hear, I saw Apex on social media. Oh, I love what they're doing. Oh, I saw this. Oh, of course.
Oh, thank you.
I saw them, signing these termination notices with insurance carriers, right? So of course we already got to cover that. But, it's cool to see. One of the things that I like the most about that is just how real and authentic it is. There's people appreciate production quality in some things, and there's times where it's worth it. And then there's also, the truth that people appreciate authentic and real and unedited and behind the scenes sort of things. And so, when people are following you around and you just have you're just mic'd up and treating patients and stuff like that, that seems like some of the content that really lands best with people. And like you said, a lot of times people expect it because they've already seen you on social media before they come in. It's been a big part of your marketing, right? I mean, I don't know can you quantify, or do you have a sense of how much your social media efforts have actually translated to getting more patients in the door and making a tangible, objective benefit into your business growth?
Yeah, that's a great question, because that's the hardest thing to measure, right? And again, I think I go back to, that's probably why a lot of PTs, why we don't necessarily like to do it, because we can't see that immediate ROI to it, right? Like, I put up 5 posts. Why don't I have 5 new patients? What's going on, right? So instead, like, you have to listen to a lot of factors. Like, I watch the engagement, right, on social media platforms as well. So you can start to see like your followers, your likes, your all of that. You start to see that in like that increase. So you're getting over a wider spectrum. I also listen when patients will come in and they'll say to me something about, or to one of my other providers, something about, oh, am I going to do that, like that electric thing? Am I going to do that thing with the pads on? I want to do that today. Am I going to do dry needling? Like, I want to do that. We haven't even talked about that. So I know they're getting it from, what makes you want to do that? I saw my friend so-and-so in here on your story. They did it. So I want to do it. Right. So it's more in the feedback and in listening to our patients as consumers, right? Okay. Again, what do they value? They value the opinion and the experience of their friend or family member as they see it through our social media channel, that they really see that the trust and the safety in that. So
that's awesome. Very, very well said. And it's very consistent also with my understanding, where there's these statistics that people say it takes an average of 7 touches or interactions for someone to finally feel confident enough, safe enough to become a customer of yours. So you have to hear it from someone, see it on social media, look at the website, see it again somewhere else. There's all these different. So that is a great way to have, if you have to accumulate 7 or somewhere between 5 and 10 interactions on average with somebody, that is a great way for them to interact with you. It's low risk to them. They can observe, but they can, as they get a sense of your brand and start to develop these positive associations, you'll be top of mind when they have a musculoskeletal issue, especially if they see you're doing diagnostics and they would have previously thought, oh, I need to go see an orthopedic surgeon first or something. They're like, well, for something like this, looks like they can even diagnose me there. So it's education, developing that sense of safety and comfort with you. And like you said, building a brand is a long-term strategy. The Rock at his tequila company, he didn't do a lot of, paid advertising and stuff like that. He spent all these years building a persona, building a huge following on social media. And then, and he drank tequila, in every 1 out of every 5 to 10 posts. And so when he came out with the tequila company, he already had this brand established, and he could transfer all that value and build it immediately, into a $1 billion company like that. So building a brand is a long game, and it establishes a lot of value that can potentially be captured in a variety of ways. So just try to elaborate a little more on what you said, but I think what you said is excellent.
That's a great example on how, again, it leads to expansion. So that's a great example.
Yeah, for sure. So we talked in this concept of marketing. I also love your definition of marketing. I just want to highlight that one more time, of all the activities that lead up to a sale. is that what you said?
Mm-hmm.
All the activities
Mm-hmm.
that precede or lead up to a sale, right? So
Mm-hmm.
that was good. And then in terms of social media, gotten to talk about that. Can you talk to us about some of the other marketing that you're doing? The pounding the pavement, getting out there in the community. I know you've got the tech truck. You're going offering services at events. What have been the most impactful, in-person community-based marketing strategies and events and different things you've done there?
Yes. So again, if we go back to that primary care PT model, right? We need to get in front of our community, and we need to be able to educate them what we can do as physical therapists, especially in this primary care role. And we look at, who is our practice's avatar. I think, Garrett, you touched on that in the beginning. We started with a very niche of CrossFit athlete and Spartan race obstacle course athlete. And that has really turned into athletes. And so one of the biggest things that we do is attend a lot of the various athletic events that are going on here, especially CrossFit competitions. And so we have a pretty cool tech truck that's fitted with, we have a newbie in there, and we have, things like cupping, and we have some Normatec boots and just some other like recovery, some A-stem scraping, some other recovery tools in there. And we take the truck, we go to the CrossFit events, and we will provide complimentary services to any of the competitors. And so this really allows us to immerse ourselves in that community, allows us to show them what we can do and how we treat this population. So if you remember, I'm from Southwest Florida, and our demographic is predominantly Medicare. That is when I started the practice back in 2005, and kind of up until we made our big switch into the athlete community, practice was probably anywhere between 70 and 80% Medicare. And we identified that there was a huge gap and a huge need for an underserved population, which was the athletic community. Everybody thought, you're in Southwest Florida, you treat the Medicare demographic. That's just what you do. And so being able to provide services to a group of people who didn't even know that physical therapy was something that could help them throughout their journey of pain, injury, wellness, optimization has been, that's just been an awesome experience. The persona here, again, in Southwest Florida is, oh no, that's just when grandpa breaks his hip. Like that's when we go to physical therapy. Maybe it's after like an athlete had an ACL surgery, maybe. But, other than that, we didn't have that privilege. So by putting ourselves in, where the athletes are, putting ourselves in their environment and supporting them, taking care of them, that's been a huge win for us.
That's awesome. And a big part of that growth and movement towards a primary care model and marketing and all these things that we've been talking about so far really is that, letting them know that PT can help them, because there are a lot of athletes who would think, PT is for my grandpa, or that's what you get in the hospital to help you learn how to walk, how to transfer, or, stuff like that. So really helping to clarify, I wouldn't say redefine the perception in some people's minds, but clarify, help them, get a real appropriate understanding of what physical therapy can do. And I love that tech truck, because you can go out and set up shop and really show people what you can do. And it also was a catalyst that enabled you and us. We're grateful to be involved in this, this partnership, but enabled you to work with the United States men's gymnastics team, the Olympic team. And as we record this, we're, a couple months away from the Paris Gymnastics coming up summer of 2024. So can you talk about, first of all, a little bit how that relationship came to be, you know, Tech Truck being part of it, and then the extent to which Apex is supporting the men's gymnasts?
Yes. Thank you for bringing that up, Garrett. It's really a full circle conversation, because the way that partnership came to be was through a social media connection. So when we think about, you know, expansion and that side of it, so it was a classmate of ours that reached out to me on LinkedIn. Mind you, I'm an old PT. I graduated a long time ago. And so this was, you know, a PT reaching out to me over LinkedIn that I hadn't even heard from in 20 years, and said, hey, the men's USA Gymnastics Team was training in Indianapolis, which is where I went to school and where he was practicing. And they're moving to Sarasota. They asked if I knew anybody that did sports in Florida, and I thought of you, and you were the closest. So can I give them your contact? Bam! Like, how cool is that, right? So we exchanged contacts, whatever, and we said, okay, yeah, we would love to come up to, they have a training facility in Sarasota. And we said, yeah, we would love to come up and talk to you about what we can do to serve your athletes with not only rehab, but also their recovery. And so this is, again, where the tech truck came into place, again, getting out of the community and outside of the four walls, right? So got to drive the truck up to Sarasota, had all the cool things inside. Their space was outfitted pretty cool with like sauna, cold plunge, red light. And, you know, we were able to come in and say, all right, now this is what we can do. We were able to show them what the NeuFit was able to provide, most significantly from a diagnostic and preventative standpoint. So we did some sample mapping and screening on the athletes that day when we went up there, and we said, hey, we're just going to show you like what we would do. And we said, you know, this would be part of a routine assessment that we would be checking in all the time, because our goal would be to stop anything and prevent any injuries or prevent any breakdown before it would happen. We also incorporated HRV technology, which we said this is something that we want you guys to be consistently looking at and monitoring. Also, again, this is all from a preventative standpoint, you know, very high level elite athletes. And literally, I think Joe was there for like 4 hours, and they were like, we don't want to talk to anybody else. Like, we want you guys to come back. How do we do this? And we want one of those machines here. How do we make this all happen? So it's a pretty cool story. We have one PT that spends all of his time up in Sarasota, and he is devoted to the men's US Gymnastics hopefuls. And so, yeah, he's with them 5 days a week. And in that, he's also been able to, like, where they train at, there's also, you know, the public can come and train there on off hours, you know, this huge gymnastics arena. And so he's also been able to educate these other younger kids that are up and coming on the benefits of this. And so we also started a program with them. So the hours after the Olympians are training, he provides services to the members of the community that are also training there, and see what the Olympians do and really want to be just like them. So, if they're doing it, then I want to do it. And so again, we're just really broadening the horizon of what physical therapy can do in the community, as, again, that primary care piece.
That's awesome. And it's been very cool. Apex, you know, as you mentioned, has been the main leaders establishing the relationship and taking care of the athletes and doing all the wonderful things there in Sarasota. I also got to go to that facility and spend some, you know, actually work with some of the athletes, you know, many months ago, around the beginning of this partnership also. And, I've gotten to talk with the physical therapist who's there on site and different things. And it's been very cool to see. It adds a lot of value. I mean, they're really excited about it because they have this primary care person for all the stuff that comes up, the tweaks, the injuries, the stuff they have to deal with. To have that primary care resource on site there is so valuable to them. They love being able to work through those little nagging, those little aches and pains that could become more serious injuries. They can work through them so much more quickly and efficiently, so they don't become the more serious things that can derail a career or derail an Olympic cycle. So it adds a ton of value, and it's a really cool facility, and I'm super excited about the whole team that they've put together there. The coaches, Kevin Mazika, the head coach, the last time the U.S. men medaled in the Olympics, 2 decades ago. Sam Mikulak, who was on the team previously as coach. They've got a great staff, a great culture there, and I can feel some Apex infused into it as well. Very, very collaborative, excellent. We're of course honored to be able to collaborate with you and them on that too. I'm really excited to watch in this summer Olympics in Paris.
Yes.
So it's good. As we wind down here, let's see. Is there anything more to say on the marketing front in terms of in-person things, social media things? I want to make sure we cover all the bases there.
I think I think in just closing the kind of tying the bow around the marketing piece, I'm in a stage in my business where many other practice owners might be here as well, or possibly getting ready to be into this piece where I'm really taking on more of a CEO leadership role and really trying to build the leaders beneath me, and really trying to focus more of my time on working on the business as opposed to in the business. I still have the privilege of treating patients 1 day a week just because I absolutely love it. And I want to be able to still immerse myself into that community and know what it is that my patients are valuing, so I can make sure then on the other end, right, that I'm driving that into whatever our business expansion is. But in that, I came across one of the books that I've been referencing is Scaling Up by Vern Harnish. And there's a quote in here that really stuck to me the other day when I was going through it. And it said, the number one functional barrier to scaling up is the lack of an effective or an affecting marketing department separate from sales. And so I thought that was, again, just super eye-opening in looking at where, as the leader of my company, where I need to be making sure that I'm putting, my attention, making sure that I have the processes, the systems, the messaging, the branding, that I'm leading that front in that market. Doesn't mean I'm doing all of it. I have 3 amazing people, Joe, Megan, and Marissa, who all assist in that, but in just making sure that is the gas pedal, the foot does not come off the gas pedal on that.
That's great. Vern Harnish is great. Actually, I met him recently at a mastermind event in this group called Genius.
You know everybody. I need to hang out with you more, Garrett.
I talked to him for a few minutes. I wouldn't say we're best friends yet, but he's a great guy. And so that book is excellent. Scaling Up. I think at least in my circle, this could be a limited perspective. I think more people are more familiar with Traction, which is another book. So they're both Scaling Up and Traction are books on essentially how to operate a business effectively. So in Traction, they talk about EOS, the entrepreneurial operating system. So it's how you structure your team and assign roles and responsibilities and accountability, and how you hold meetings and do strategic planning and make sure everyone is aligned towards implementing that strategic plan. and how you do metrics. And, I mean, so it literally is like a recipe how to run a business. And so scaling up is an even more robust version of that. And the guy that wrote Traction used to be a coach for Vern Harnish and worked for the scaling up organization. And so if you read the two, or if you're familiar with them or trying to kind of understand the lay of the land, that's just sort of a context. There's the Traction EOS is sort of a subset of all the tools that are in scaling up. And so some of it depends on the level of sophistication of the business and different things like that.
Sure.
But that's a great book. So highly recommended. And Vern Harnish is, in my limited experience, was also very, very intelligent, very gracious, and definitely knows his stuff there. So yes, a great book. And you're implementing it. You're doing it.
I got to take the actions, right? Just got to do it.
Knowledge is not power. It's potential power.
Oh, very, very well said from Mr. NeuFit himself.
just knowing, you can read a book and you can know it, but if you don't actually implement it, then same thing. You can listen to a podcast and think, oh, that's a great idea, but implementing your version of it is the thing that's actually going to move the needle. And
yes,
I think that's one. We talked about how the business model, the strategies that you're using can be inspiring. I think we should also call out the fact that you're actually taking action and doing it. The work that goes into just regularly putting out content on social media, the work that goes into the people on your team who have gotten the training in MSK, ultrasound, and electrodiagnostics, and done those other things. So you're really committed and gone deep in these areas, and it's made a difference. And I do feel very optimistic that everyone listening to this is going to find many pieces of inspiration, but at least one thing that will be able to move the needle for their business. And so I invite everyone listening to take action, figure out at least the one thing from this episode that they're doing at Apex that you feel like you could do more of in your own business. And Angie, do you have any parting words, anything else that you feel like we should get across before saying goodbye here?
I love that the action potential that you talked about there, right? I love that. And I think that that's a great place to end, because it doesn't have to be, the specific actions that we've taken, like broaden that scope. And one of the things that the newbie and being a partner with NeuFit had done for our practice was it did allow us to take action with our avatar patient. So the newbie can be whatever you want it to be. Who is it that you really want to serve? And that newbie, or that whatever that action, like it can do that it did it for athletes for me, but it can do that for a whole world of so many different people, right? So I think that you and I have talked about, Garrett, that really isn't every injury kind of stemmed from neurology? Is it everything neuro? Everything is neuro. So when we think about it from that standpoint, it is, and there's other tools, as Garrett said, there's ultrasound, there's, the other things that we've brought into practice, but just use that as knowing that, it's that action step that you can make whatever you want to make it. We made it for athletes. You can make it whatever you want to make it for who you want to serve.
That's right. Every patient is a neuro patient, and you can help them in some way, if not many ways. So it's an excellent note on which to end. Hopefully everybody listening to this already follows you on social media and everything, but can you just in case they're not and they want to look you up, what channels are you on? What are the best places to find you? What's your Instagram handle, etc.? Just let us know where to follow along on the Apex journey. I can tell you. She does. So it's at. I'll answer my own question, Angie.
Okay, very good.
At Apex Physical Therapy SWFL for Southwest Florida. Apex Physical Therapy SWFL.
There we go.
You'll see both my personal page and the NeuFit page are are following along there. And then that's where I interact with you and see most of your content. Also LinkedIn too. Any other channels or platforms? I don't even know. Do you have a YouTube page, or you haven't ventured into that yet?
That is in one of our priorities for this year, is to really delve into that piece of the marketing that we have not done yet. So yes, look for us on YouTube. My LinkedIn is just my name, Angie McGilvrey. If I can just, one other social media is my rescue dog, and his name is PT, of course, and his Instagram it's PT_the_dog, and he's our three-legged mascot, and we actually utilized NeuFit on him when he was rehabbing his only back leg from ACL surgery. But even more so, he has a children's book, and his children's book is all about never giving up and the power of being kind, teaching kids kindness to all beings. And all of the proceeds from his book go to animal rescue. So if that's something that touches your heart like it does ours, then we appreciate you following PT the dog and spreading his message.
And I will share a testimonial.
Sorry, Garrett, I had to do the shameless plug there.
For the book, I read the book. I ordered it on Amazon, read it to my children. It's fabulous, and I also got a signed copy we put some ink on PT's paw, and
yes,
we have a second copy that's signed also. It's wonderful. So I'm glad you mentioned it. I'm disappointed in myself for forgetting to bring it up too.
No. Thank you for the opportunity.
Well, definitely, yes. PT runs free. Is that the title?
Yes.
PT.
Yes. PT runs free.
Yes. Well, that's good. So thank you, Angie, for coming on the show here and sharing what you're doing at Apex. And I already have said, and definitely will close by saying again, that I hope people find inspiration in some or all of what you're doing there, and that as you continue to push forward, you're lighting the path for other people to expand what the profession can do, what a private practice physical therapy clinic can be, and you're a bright, shining light example. So thank you for doing what you're doing. It's an honor to be able to call you a friend and a colleague.
Aww.
And please send my best to Joe as well. And the whole team. I actually love the
absolutely
narrative. So
absolutely.
Thank you, Angie.
Pleasure is all mine. Thank you, Garrett.
And thank you, everybody, for tuning in. We will see you on the next episode of the Undercurrent Podcast. Please like, subscribe, and all that good stuff. Bye-bye.